So we expect deal making to accelerate in 2018 as M&A is really proving to be an effective solution for companies looking to propel their strategic goals. We've seen consolidation in the payer industry, which has left many of these big biopharma companies exposed to a very challenging pricing environment, and we expect them to react by consolidating themselves. Furthermore, US tax reform, the availability of cheap debt and strong balance sheets has provided big biopharma companies the financial firepower they need to make these deals and overturn sluggish growth prospects in the face of patent expiries of their key drugs. So in this report, we've identified 3 categories of deal objectives that we think big biopharma companies will look to drive growth. So for example, targeted deal making. We think that small biotechs with very highly focused development portfolios present very appealing options for big biopharma companies. Through these deals, the big companies can effectively outsource the development of their products, and this lowers any risk associated with development costs. However, the only catch is that these companies come with a very substantial price premium. This is a price that many big companies are willing to pay. However, some companies have noted concerns with valuations in fiercely contested therapy areas and opt for in-house development of products instead. These companies will maintain their discipline in deals that really promote strong shareholder value benefit. So I think following wider consolidation across the whole supply chain, that we will have another cycle of M&A in the manufacturing industry itself. So we have companies like Pfizer, which we expect to leverage their core competency in large-scale M&A, and this will spark a wider consolidation within the manufacturing industry. So on top of this, you have the threat of incursion from large technology companies such as Amgen, which are seeking to leverage their capabilities in data analytics and AI to really drive the next generation of healthcare. We expect a reaction from big biopharma companies who will look to increase their capabilities in technology and really stake a claim in a healthcare industry that is going to be swayed by technology in the future. So in this report, we highlight some of the key companies that are on the lookout for M&A and some of the key criteria that are associated with these companies that are looking to make M&A deals. So for example, you have companies like Amgen, which have got a huge amount of overseas cash and are going to benefit hugely from US tax reform. Amgen is facing the patent expiry of its lead drug, Enbrel, and its pipeline is looking very much depleted compared to many of its big pharma competitors. So we are unconvinced that the company is going to be able to overturn these declines in Enbrel with its newer offerings, making it a prime target for making M&A deals. Furthermore, the company has stated that it is agnostic to the size of deal it makes and has said that it is happy to do both large-scale and small-scale deals if the price is right. So in terms of bolt-on deals worth between 2 and 10 billion, you have companies that own a limited number of clinically proven assets that can sometimes be already on global markets. So for example, you have Tesaro, which has recently received approval for its PARP inhibitor Zejula, and we expect this drug to have a very strong growth trajectory. You also have companies that own much earlier stage assets, and these companies are valued much cheaper but are associated with that risk of development. So for example, you have Selectis, which is developing some of the most advanced allogenic CAR-T therapies in phase 1. And finally, the report identifies much larger companies worth above 10 billion that will be very appealing to big biopharma companies that have the financial capability to make such a deal. So for example, Vertex, which has successfully launched several cystic fibrosis drugs and is really the leader in this market.